Welcome back. We continue now with your report here on Newsfeed Late Night. Cabinet Secretary for Health, Mutahi Kagwe, has told a press conference that Kenyans need to prepare for another difficult period. It comes as the country faces a third wave of COVID-19 infections. For more on this, I'm joined now by Kenya-based journalist Terry Nzao. Terry, good to have you with us again tonight. First and foremost, leader of the opposition reported to have contracted COVID-19. Can you confirm that for us?
Good evening. Yes, it's confirmed. The opposition leader last week contracted COVID-19 after an intensive week of campaigns in the coastal Kenya. And he was reported that he was the one who took himself to the hospital. Then the doctor said he was fatigued and he had some joint aches. So after several tests, that's when it was confirmed that the opposition leader Raila Odinga had contracted COVID-19. But as we speak today, he was discharged from the prestigious Nairobi hospital, and he's receiving treatment at his home place in Karen, where he's self-isolating.
Now, it is almost a year now since Kenya reported its first case of COVID-19, and so far the country reporting more than 110,000 confirmed cases. Now, there is a talk of a third wave. Now, a third wave would be defined in terms of the medicines as a new wave lasting more than 1 day, commencing after the end of the second wave. So it means you are beginning to see a rise in new cases. Why are the cases rising?
Sure. In the last 3 weeks, we've reported spike in the cases of COVID-19, with like today reporting above 400 cases. Yesterday we had like 750 cases, and on Friday we reported 870 cases. Our health officials are led by the Minister of Health, that is Mutahi Kagwe. They have already projected a third wave of COVID-19 as a result of mostly laxity by Kenyans, because we've seen politicians have gone back to a campaign mood. We are almost doing a referendum on our constitution. So most of the politicians, led by our president, the leader of the opposition, our vice president, and other leaders, they've been in campaign mode. We've also had by-elections where we've seen politicians transversing from one county, from one area to the other. So probably we could say most of the campaigns are to blame for the increased cases of COVID-19. The other issue is about also Kenyans putting down the guard. We've seen, like in our normal transport sector, matatus or our public vehicles are carrying more than the number that was set by the Ministry of Health in conjunction with the Transport Ministry. People are not washing hands, are not observing the COVID rules that were set like we started last year, a time like this. So we can say laxity by Kenyans mostly is to blame, but a bigger percentage, the political rallies.
So what is in store then for the future? What did the president's address reveal on Friday?
On Friday, President Uhuru Kenyatta gave a directive, and the first directive that he gave, the first public order for 2021, was to ban all public gatherings, all political rallies for the next 30 days. He said this was a measure to curb spread of COVID-19. You know that even as we enter into the third phase, we are having a new variant. The world is facing a new variant. So he said that all political rallies, all political gatherings, social and public gatherings are banned for the next 30 days, so as to ensure that at least we are contained and we avoid this overcrowding that we've seen. But nevertheless, we've seen even a day after, politicians are still ongoing with their political rallies. Today, we've seen most of them, especially where we are experiencing by-elections in the coming week, there have also been overcrowding in churches. So as much as the president of Kenya has given a directive, the politicians are defying the orders.
What is the government doing in preparation for this third spike or the third wave of the coronavirus in your country?
Already we have a committee that is in place, led by the chair, Dr. Willis Amukule, and the Minister of Health, who is Mutai Kagwe, and they've said they have already put measures like sensitizing Kenyans about taking care of themselves during this COVID era. They have ensured that the health workers are given PPEs. They're also ensuring that we have portable oxygen, especially for those who need COVID treatment outside in the outside facilities, because already we've set around facilities in our stadiums, apart from the hospitals. So there are measures that have been put in place. And I remember in this coming week, our Class 8s and Form 4s are going to sit for national exams. So the government decided to close the schools by end of this week so as to give time these students who are going to sit for the national exams, and also to avoid overcrowding in schools. They have also put other measures like extending the curfew with another 60 days. And in churches, the president decided to cut the number of those people who are appearing in churches by a third of the capacity. There are other issues that the government of Kenya has already given out, like in funerals. If a loved one dies like today, you've been given only 72 hours to conduct the funeral. And this is limited to family members and a number of 100. It's capped to 100. The same as to weddings. It's capped to 100, and it should be attended by only close family members, among other issues like ensuring that bars and restaurants by 9 p.m. they are already closed.
Now, the president on Friday presented data that shows that the economy of Kenya had grown 10 times slower than initially planned. What are the measures announced by the president as far as the economic recovery is concerned?
Sure. President Uhuru Kenyatta said by 2020 we were expecting the economy of the country to grow by 6.2%. But unfortunately, it only grew by 0.6%, which is a loss. That's around 560 billion Kenya shillings. But he said this was nothing to worry, because apart from losing in terms of money, we saved lives. We didn't have so many deaths, and also we saw the rate of infection went low. And in that, he said that the best gift that a government could give its citizen, it's ensuring that they are safe. When they are safe, people will take care of themselves and they will revive the economy. And that's why he said that he's going to impose these measures to ensure that the Kenyan economy still remains strong. He said though it was shaken, it did not cave in. So apart from the curfew that we saw, he also gave measures like the essential service providers to continue providing their services. For example, the construction workers and other service providers, even after the 9 p.m. curfew, they are supposed also to continue giving services to Kenyans. And he mentioned something that us as Kenyans, we found that it was a good thing that he did, because he said, even though our economy was shaken by COVID-19 in 2020, it means that we as the people, we were not that shaken, because around 1,879 people died of COVID-19. So what the president emphasized was the need of a healthy nation. When people are healthy, when people are protected from COVID-19, they will revive the economy later. He said, reviving an economy is something which is easier, but it is hard to revive a lost soul from COVID-19. And that's why he's emphasizing we ensure that we follow the set guidelines to prevent COVID spread, and also to ensure that the protocols that he gave are followed to the latter.
Now, the country, of course, when we're now looking at the inoculation program, is hoping to vaccinate 15 million Kenyans by June 2023. Now, with the fear of a third wave, have those numbers or those targets been revised? And is the country expecting more vaccines to be delivered in the near future?
Sure. Apart from the first bunch of COVID-19 vaccine that we received, the AstraZeneca vaccine, we have also received 100,000 doses from the Indian government, which gave as a donation to the Kenyan government. And the committee that's handling COVID vaccination, it has already given an indication that by the first week of April to May, we are expecting at about 2.5 million doses of the COVID vaccine, either the AstraZeneca or the others, but mostly they are saying the availability of Pfizer and BioNTech, it's a bit shaky, but they are hoping that by the first week of April, we are going to receive more doses. In the first week after they launched the vaccine, they reported that 9,000 people, 144, they had already received the jab. And they are also expecting that bi-monthly they are projecting to be, daily they are projecting to be vaccinating around 15,000, meaning in 3 months' time, they'll have vaccinated 1.2 million Kenyans. And by June, like the way the Ministry of Health is saying, they are hoping that 20% of the Kenyan population, they'll be inoculated this vaccine. But apart from that, there's the hesitancy issue, putting in mind that the vaccine, the AstraZeneca vaccine, has shown some negative, it has shown some side effects. So some Kenyans are still having that hesitancy of receiving the vaccine, but we've seen the Ministry of Health and the Kenyan government ensuring, trying to preach about the safety of the vaccine, telling Kenyans that apart from the issue of the small issues being raised by other countries, the vaccine is safe, and they are urging their citizens to get the vaccine. We've seen most senior government officials on the forefront of getting this vaccine.
Terry Nzau, I appreciate your time tonight, and thank you very much for coming through. That's our Kenyan-based journalist, Terry Nzau, giving us an update on the news coming out of the country, a possible third wave being looked at now, and the country going back into lockdown and the cutting out of certain activities, including political activity there.